All right, so let's break down the top 2020 conspiracy theories that turned out to become reality. They are now true. We're going to break down, I have about 17 quote unquote conspiracy theories that we're going to unpack. These are theories that your friends, your coworkers, your family, the people on the Twitter sphere and Instagram said, you know what? That's not real. That's not realistic. You don't know what you're talking about. Stay in your lane. Trust the experts. Follow the science. You know, all the things we heard. So the number one conspiracy theory that turned out to be true is everyone's risk for dying is not the same. It turns out that underlying health conditions increase the probability or the odds that you even get COVID-19. So we talked about that study before that found that obese individuals are 46% more likely to test positive for COVID-19. We talked about the underlying health conditions, the hypertension, the high blood pressure, the uncontrolled diabetes, all of the cardiometabolic issues. All of those factors, friends, were more commonly found in people who were hospitalized or died or had severe COVID-19. Okay, so everyone's risk of getting severe COVID is not the same. A lot of people have been double and triple masking. They have boosters. They're masking in their cars still to this day, and they are under the age of 65. What the media didn't do a good job of doing is letting you know about the realistic figures and statistics when it comes to who is actually dying. There's statistics that we can share with you right now from our own CDC. Underlying medical conditions and severe illness among 667,000 adults hospitalized with COVID-19 between March of 2020 and March of 2021. Guess what they found? Among these individuals, where they had medical records and so forth, 94.9% had at least one or more underlying health conditions: essential hypertension, which is high blood pressure, disorders of lipid metabolism, again, a reflection of uncontrolled diabetes and poor metabolic health, comprised 50% of these individuals, and obesity were the most common. Now, there's a list of other, common preventable diet-related and lifestyle-related disorders that, guess what, increase the risk of dying or having a severe illness that were mentioned there. So that ties into some of the other factors that we're going to talk about. But among those, a lot of people don't know this figure, that about 80% of the deaths from COVID-19 in the USA, in the United States, occurred in individuals over the age of 65. So you have parents with their 5-year-olds who have double masks. My daughter's 9. She's in 4th grade. There's literally a kid, one child in there who wears a mask and a face shield every day. Poor kid. There's another kid that wears 3 masks every single day. Okay. Now, I don't know what's going on at home. Maybe they live with a great grandma or something. I'm not sure. But to me, it seems a little excessive, especially considering the fact that in the state of Washington, I've been on conference calls with the Department of Health. Over the last 22 months, there's been 17 children under the age of 19 in my state that have died from COVID-19. There's way more children that have died from influenza, car accidents, drowning, probably unintended harms or violence in the home compared to the kids that have died from COVID-19. Yet you have people acting completely irrational. So that is myth number one, that everyone's risk of severe COVID-19 is the same. Now, I say this because I have clients who have put on 20, 30, 40 pounds, okay, and are still scared to go to the gym. They love going to the gym. They like talking to friends. They like the classes. They're scared to leave their house because they are operating under the illusion that COVID is going to kill them, even if they're vaccinated and young and previously healthy, okay? So perpetuating this misinformation harms people, and we're going to talk about some of the other harms here as we go on. Okay, so number 2, okay, this is that nutrition and exercise have nothing to do with the virus, Mike. Come on, eating McDonald's and stockpiling soda pop, sugar, and flour have nothing to do with a virus. You're creating this, what they would say, a false equivalency. That was the comment that I heard the most, okay? Well, it turns out that uncontrolled diabetes, even glycemic variability, people who don't exercise or have low previous physical fitness scores and so forth. We've reviewed this data. That's going to be another session coming shortly. Data from our own military, data from South Korea, where they have standardized pre and post exercise assessment scores. Henry Ford Hospital outside of Detroit did a thing with individuals who had standardized cardiovascular stress tests, and they looked at outcomes with regards to COVID-19, and guess what they found? Poor cardiorespiratory fitness prior to the outbreak led to increased risk of dying or being hospitalized. We have the data from Kaiser Permanente that included over 48,000 subjects that had, again, standardized assessments with regards to physical activity. We have data from Sweden. Remember the military cohort? We've reviewed all these studies. I'm going through this quick. Go to our YouTube channel, go to our website, highintensityhealth.com, and check out, just type in exercise COVID, Sweden exercise study. All these things will show up. I'm putting together a book to like give this to you because I'm sure you have friends who are like brainwashed. When they think COVID, they think death, and they're healthy, right? So I'm not trying to say that you shouldn't exercise caution. I'm not suggesting you lick the toilet seats in the ICU. I'm suggesting that we reframe how we review improving health, okay, into reducing our underlying health conditions, prior improving our cardiorespiratory fitness and much more. So let's go on and talk about cases, right? The case-demic. We're going to talk about that. But first, friends, thank you for being here. I'm Mike Mutzel. I'm grateful that you're tuning into this video, into this podcast. What I will do is link all the resources that we talk about on our website, highintensityhealth.com, where I would encourage you to go and opt in and get a blood work cheat sheet and join our email newsletter list because we are sharing a bunch of great content to help you improve your health in 2022 and beyond. There's a lot of things that you may not know about with regards to blood testing, blood work, differentiating your risk factors, looking at triglycerides and your cholesterol and ApoB. There's a lot of cool ways that you can further assess your own health. And we want to help you in that process. We have do-it-yourself e-courses. We have a bunch of great tools over on our website. So hop on over to highintensityhealth.com, opt in, check out the blood work cheat sheet, print out page 1 and go to your doctor during the month of January or whenever you're watching this video and get some blood work. A lot of people don't I have doctor friends. I mean, this is how sort of underemphasized labs are that haven't had labs in the last 10 years. You need to know your labs so that when you change your diet, you change your fasting, feeding windows, you know where you're going, right? If you don't have a reference point and you don't know where you want to be, then what are you really doing? Okay, so let's test, not guess. Go over there, highintensityhealth.com. Check that out. I will link that below. Okay, let's talk about the case-demic. So we're on number 3 here. So using cases as a way to gauge the pandemic is just bad. Now, when we said that, people said, oh, you're not taking the pandemic seriously, Mike. You're just not even... No, look, there's a lot of people, and again, this is another statistic. This could be conspiracy theory number 18 that became true. A supermajority of infections were either mild or asymptomatic. So when you're testing a bunch of healthy people, what are you doing? You're creating fear. You're creating panic. You're creating unnecessary collateral damage and restrictions and all of these things, which have consequences, my friends. That's the biggest thing we've kind of forgotten about is all these things have consequences, right? And we're going to talk about fear in a moment and how fear was the second leading risk factor for death, according to the CDC, okay? So the case-demic and using cases as a proxy or a gauge to assess sort of the trajectory of this pandemic was a bad idea. And guess what? 2 years later, Anthony Fauci himself, Dr. Rochelle Walensky, the director for the CDC, is saying that same thing, saying, well, you know what? Maybe we shouldn't use cases. Now, it's funny they say that now when the U.S. is having record levels of cases. In the last day, this was according to Reuters, USA Today, and NPR, there's been over 1 million cases confirmed in the United States, okay? We're almost 2 years into 2 weeks of flattening the curve, and the cases are... The curve's not flat. It's like a vertical line into the stratosphere, okay? And just now we're saying, well, maybe we shouldn't count cases, friends. All right, it was a conspiracy theory. We said this a long time ago. We should be looking at severe disease and stratifying risk and protecting the people who are more vulnerable and more likely, more probable for contracting a severe disease or dying. Okay, it's called risk stratification. We should have been doing that. We haven't been doing that. We've been using cases to drive paranoia, fear, and irrational behavior. Bad idea, okay? So that became true, and guess what? Everyone's saying that. Okay. We're on, I think, number 4, okay? Mandates and restrictions are the solution. Your governor, your mayor, he or she is going to save you. They are the savior. They are going to totally protect you, even though they've never met you. They don't know what you eat, where you live. They can't control this invisible virus, but somehow they're going to protect you. And a lot of people bought into this. They only went out to dinner at restaurants that required passports or in testing and all this. Well, guess what? All those people are now sick with COVID. You don't have to just take my word for it. Go and look at the numbers in New York City. New York City and Seattle, I'm going to break down these stats. They are leading the nation, my friends, with new cases. So if all these restrictions really were the sine qua non, this is the solution to going forward. Why isn't it being reflected in the data? Now people will say, well, the hospitals aren't being overfilled in those areas. Okay, so now we're going to talk about disease severity, because if we're going to then talk about severity, then why do we close the gyms? was McDonald's open, right? If we're gonna go down that road, then we should be talking about health. And we've been ignoring health the entire time because actual health dramatically reduces the probability of having severe disease, but we've been ignoring that. So let's use the metric that the media and the experts have been using this entire time, and that is cases. And guess what? New York City Metro, okay, is second only behind Miami, Florida, which has essentially no restrictions, no vaccine passports, no mask mandates, at least at the time of recording this video. Now, some businesses in Miami might have a one-off mandate, okay, but there is no city ordinance, especially to the effect that New York City Metro has. Now, if we look at the new daily cases in Miami, Florida, it's 400 per 100,000. If we look at New York City, again, you can't even, breathe oxygen without a vaccine passport in New York, rarely. Okay, I'm exaggerating, but you get the point. Okay, it's 348 new cases per 100,000. You're like, well, can someone share with me why aren't we seeing a tighter correlation? Now, if you look at Puerto Rico, out of all the different sort of property that is governed by the United States of America, Puerto Rico had the highest vaccination per capita rate. Interestingly, here, out of the top 10 metro areas in the United States, Puerto Rico has three of the top 10 most sort of highest new infections per capita, per population. Okay, so the point is, my friends, is there's not a strong correlation between what the government is doing and does and a reduction in sort of transmission or cases, because this virus is transmitted on an individual level. And the government can't control what people are doing, how many people are having in their home, the foods that they eat, the exercise that they do, which, by the way, impacts the effectiveness of the vaccines. And we're going to talk about that in a moment. Okay, now here's another very interesting statistic, and this is the positive test rate. And I'm getting this data from COVID Act Now. Okay, this is covidactnow.org, I believe is the website. I will link it below in the show notes. Okay, so Governor Inslee, the governor of Washington State, which happens to be the state that I live in, has had a lot of sort of draconian measures, extensive business closures, restrictions. You can't have more than 25 people in an event. There's vaccine mandates in King County, all of this. Well, it turns out that in the state of Washington, we are leading the nation. Okay, in terms of metro areas and positive test rates, Washington State holds 7 of the top 10 spots, my friends. So in Yakima metro area, 59% of the COVID tests are coming back positive. Okay, there's been all sorts of business closures and restrictions and mask mandates all throughout the state, and especially in Yakima and Bremerton metro area, number 2 in the nation, 54% of COVID tests come back positive. My favorite here is the Seattle metro area, because Seattle, there's a lot of science followers. If you don't know, if you haven't been to Seattle, there's a lot of science followers, double maskers, a lot of people who are really doing everything to end this pandemic. Well, it turns out that in Seattle metro area, 45.2% of all COVID-19 tests come back positive. Now, I'm not smiling because I want people to get sick. Okay. I'm smiling because, again, there's not a big correlation between so-called following the science and getting free donuts and taking a selfie because you're, helping to end the pandemic and what's happening here. What we're going to find here, a theme throughout this top 17 conspiracy theories that came out to be true, is that underlying health keeps coming up. We keep ignoring the elephant in the room, and that is the obesity. That is a cardiometabolic disease. That is the sedentary behavior. And when you look at, sort of all these so-called safety measures, they probably provide some transient benefit, but over the long haul, it doesn't seem that they're really playing out. So good job, Seattle Metro. 45.2% of all case tests are coming back positive. Now, I can assure you, all of those people are not unvaccinated. I can probably guarantee that, because if you look at the percentage of individuals who have been fully vaccinated and boosted in King County, on a per capita basis, it's up there with Vermont. I mean, it's maybe not as close, but it's very, very high. Okay, conspiracy theory number 5. We don't have time to get healthy, Mike. Stop saying that, Chick-fil-A and Krispy Kremes. Remember when Krispy Kremes and Chick-fil-A were giving out fried chicken to all the healthcare workers during the midst of a pandemic? And I said, that is such a terrible idea. Like, these people need real food, not fried chicken sandwiches and chicken nuggets and donuts. I mean, come on, these people are exposed to pathogens. And everyone said, Mike, there's no correlation. Plus, we don't have time. We all need to stay in our homes. Until when? What is that going to do? Okay, staying in your home, quitting and canceling your gym membership makes you overweight. It makes you metabolically sick. It causes social isolation. Friends, those are factors that increase the probability that you will get more sick when you're exposed to a pathogen. So those were just dumb ideas. So we don't have time to get healthy. Now, here we are 22 months into 2 weeks of flattening the curve. And guess what? There's over 1 million cases diagnosed in this country every single day. Now, I know you're going to say, well, maybe we shouldn't talk about cases. I know. I told you that 2 years ago. You said I was a conspiracy theorist and so forth. So we need to stop saying this. It's a false equivalency to relate preventable disease to increased risk for this disease because they are interconnected, my friends. It's called a syndemic. You have this epidemic of obesity, metabolic disease, of cardiovascular challenges that gets baked into a pandemic of a highly transmissible virus. And that's what you have here. The high deaths per capita, the high cases per capita, and all this in the US. So we shouldn't have ignored that. And hats off to El Salvador. Nayib Bukele is one of the only presidents of a developed country that is finally coming out and saying, you know what, we need to address the vulnerability of our population and increase exercise. He talked about stress management, getting vitamin D and sunshine, eating real food, getting sleep. I mean, you should watch that video. It only got 2.5 million video views on Twitter. We need to share that message because once we get behind this message, it's going to be impossible for policymakers to ignore this because the people that are voting, at least using logic and reason when they vote, they will vote out the policymakers that are continue to ignore the real problem. Okay. Now, this is a video we talked about on March 8th of 2021. The title here, and this goes back to everything that we've been talking about with regards to preventing hospitalizations and deaths by way of improving the communication and the education with regards to healthy living, sleep, exercise, and so forth. This was published in the Journal of the American Heart Association. And essentially the authors went on to find that 575,000 hospitalizations could have been prevented. Now, this is important because there's roughly, I can't remember the statistic off the top of my head, but I think it's about 40% of the hospitalizations at that time, those people ended up going into the ICU and about half of those people died. So we're talking about a pretty significant amount of people who we could have prevented their deaths. And so what they said is 575,000 hospitalizations could have been prevented, and a significant number of those people who went on to die could have been prevented if we addressed the underlying health issues, okay? So again, when you say stop creating a false equivalency by saying we should focus on diet and nutrition, that is not supported by the peer-reviewed academic research. And this is the Journal of the American Heart Association. It's not the Journal of QAnon conspiracies, my friends. So definitely check that out if you want. Okay, we're on number 6 here. Now this one, I love this one. All masks are equally effective, dude, right? Like, come on, just wear that handkerchief that your mom just used to like clean your socks or the dirty toilet and just wrap it on your face. That's better than nothing. False. Okay. I don't know how people, very smart people, got sort of persuaded into believing that all masks are equal. An N95 is equivalent to a handkerchief. Like, that made no sense whatsoever. And so when you saw all these people who would mask shame you, or when they would walk by you, I mean, this happened to me, they'd walk by like this, right? For those of you listening, I'm holding up my shirt. They would walk by me holding up their shirt as if that was going to do anything to prevent transmission. Here we have it. Okay, that was considered a conspiracy theory. If you criticize people for wearing a handkerchief wrapped around their face or this homemade cloth face mask from a used jacket, you're considered a grandma killer. You wanted the pandemic to end forever. You wanted to kill people. No, we were simply pointing out that wearing a handkerchief was stupid. And it turns out that that indeed is the case. Here's a USA Today article. Most people are still wearing cloth masks. Here's why that's a problem with Omicron. Okay, well, it turns out that with Omicron, it's even more transmissible because of the location in which it binds to. The ACE2 receptors are more predominant in the upper airway versus the lower airway, which is a good thing. We reported that on the 5th of December. Anyway, so it's just so funny that we all were saying this is dumb, right? What is even more dumb, you go into a restaurant, you wear the handkerchief on your face, and then you sit down, you take it off, but then you wear it when you go to the bathroom. I mean, that is even more dumb. That didn't make the top 2020 list, but anyway. All right, here we go. We are on number 7, I believe. Okay, this is another personal favorite. I should have put these in the beginning. All right, number 7. Media fear mongering has no harm. It's helping people. People can't let their guard down. False. Now, why do I say false? This is our own CDC put out this analysis. Okay, they looked at 4.8 million hospitalizations from COVID-19. Here's what they found. The strongest risk factors for death were obesity. It's a 30% adjusted odds increase. So if you're overweight compared to, or you're obese compared to not, it's a 30% greater risk of dying. The second leading risk factor, just behind obesity, at 28% comes in as a previous diagnosis of anxiety or a fear-related disorder, okay? This is, friends, this is not QAnon conspiracy theories. This is from the CDC, the Center for Disease Control. This is what they found in their analysis. So you tell me, with CNN and MSNBC and ABC and CNBC, all these networks, they had the ticker counter of how many people are dying. And we're going to talk now about, did they die with COVID or of COVID, right? Well, now it seems like that is changing too. However, we kept hearing about that. And so what did that plant in people's heads? Oh my gosh, I could be the next person. I could be dead too. Okay, if someone is going to tell you that you're going to die, that creates fear. And you start acting irrationally. You start being scared. And guess what? We know that the immune system is connected to your thoughts and your emotions. It's called psychoneuroimmune endocrinology. So if you think you're going to die, if you think you're a sitting duck, I had DMs and comments from people said, if I get this, I'm a goner. I mean, a lot of people actually believe this, and they started to it became part of their identity. I'm a goner. So what did these people do? They didn't leave the house. They didn't see their friends. They canceled the gym memberships. They ordered all of their food off Uber Eats. They did all these things. And now they're overweight, a lot of them. Or now they're even getting sick from COVID or after they've done all these things. So friends, promoting a bunch of fear and not promoting hope and not giving people the tangible tools that they can use to become healthier, to not only prevent severe outcomes with this one infection, but also to prevent the top causes of death, which, by the way, the top two causes of death, even amid the worst healthcare crisis of our lifetime, i.e. COVID-19, were still heart disease and cancer. There's still going to be heart disease and cancer during the year 2021. I can't wait for that statistic because that will be very interesting to look at that. Alzheimer's disease was another one that came up. By the way, you don't prevent cancer and heart disease by wearing 3 masks, my friends. You prevent those diseases that are more likely to kill you by exercising, by reducing your stress, by getting sleep, by going outside, by having meaningful relationships and meaning in your life. Okay, so we know that there's unintended harm associated with fear-mongering. And hats off to CNN. Earlier this week, CNN, and you heard that, they are now starting to say, well, maybe people should lose a little bit of weight because that can reduce the probability of them getting COVID and dying of COVID. So it seems that, honestly, now that cases are going through the roof, that there is sort of a shift in the narrative. And I think we're going to hear more people talking about ways to improve health. Okay. Conspiracy theory number 8, the indirects of COVID, especially for young people who are of working age, are going to be more harmful than the direct effects of COVID. Now, that turns out that was considered a conspiracy. When you said that, well, kids, they're resilient. This is what people say. Oh, kids, we can take them out of school for a year. It's no problem. Put them on a screen. Okay, well, guess what happened to obesity rates in kids? They doubled. They literally went 2x, okay? And the kids who were already overweight, they moved into the category of obese. The kids that were obese moved into the morbidly obese. Okay, my friends, that weight is not coming off. Google the term recidivism. It's there. It's real. That weight's not coming off, my friends. Depression, suicides amongst children, screen addictions now, because you had all these kids just focused, stuck on screens. And then now the parents are like, well, that's how little Johnny communicates with his friends is through the screens. They game. I mean, that's how they do it now. Well, okay, good luck getting little Johnny to break that habit. Do you have a screen addict? Read some of the books about screen addiction and behavior. Screen addiction leads to depression, leads to suicide ideation, gender dysphoria. I mean, the list goes on. I mean, and now actually what's great is the mainstream news is finally interviewing people that are saying, you know what, the unintended harms for kids, like this is going to last a generation. There's changes in IQ and all that. But when we said that, we were a conspiracy theory that didn't care about grandma. Even though grandma's protected, grandma's at home by herself. She's not, she was protected, okay? But somehow we still needed, because we didn't know the kids and so forth. So we shared that article from Plus One Biology in September that looked at the indirect effects of COVID-19 were way worse for people under the age of 45. Okay, so it's no longer a conspiracy theory. It's facts. It's out there. Yet guess what? As Omicron surges, people are closing the schools again. It's like we don't learn. In Chicago, the schools are closed. In DC, the schools are closed. I believe in New Jersey, Atlanta, they just announced they're closing the schools. So it's like we can share this information, but yet we don't listen. It's like because we have this indelible image, thanks to all the media anecdotal stories of this previously healthy person who got COVID and died. So a lot of people erroneously believe they are a sitting duck and they're going to die and their kid is going to die because the media would say, hey, previously healthy little Sally, 16, with all due respect to little Sally, oftentimes was pretty overweight. Some of the images that you saw, these kids that were severely ill were also obese, but the headline said previously healthy or perfectly healthy, which has almost become a joke. So friends, we have to be clear with these things, and it's not a conspiracy theory. Okay. We're almost done here, my friends. Thanks for hanging in there with us. Number 9, the virus is going to be eradicated, just like smallpox and polio, bro. Do you want to bring back polio? I mean, that's what people said. Oh, really? This virus that's on every corner of every continent on planet Earth, okay, is somehow going to be eradicated, right? When developed rich countries are hogging all the vaccine. I mean, think about that. You're like, oh, we're going to eradicate it, but we're not shipping any vaccine to undeveloped countries. You're like, so how are you going to eradicate it when you only are giving boosters and vaccines to people in just these rich developed countries? To me, I think that was a little selfish, even if you did believe in that idea, which no scientist worth their salt actually believed that we were going to completely eradicate SARS-CoV-2, like polio or smallpox. So, and for those of you who bought into that, and are like, you're promoting vaccine hesitancy. You know what has affected vaccine rates for other conditions like polio, like measles, rubella? Guess what? People are not bringing their kids in to get these other vaccines. Okay, so all the fear mongering because the media painted this erroneous picture that you're going to die if you go near a hospital or a healthcare center. Kids have not been getting vaccinated for other conditions like measles, mumps, rubella, and tetanus, and all these other conditions, hepatitis, right? These are diseases that actually do impact people. Hepatitis B, causes a lot of harm. Families are not bringing their kids to the doctor because they're scared. Okay, so if you're very pro-vaccine, then you should be upset with all the media fear-mongering because we're probably going to see a spike in other transmissible diseases because vaccination rates have dropped because we're so focused on this one microbe. Okay, so it's never going away. We have to learn to live with it. We've talked about that. Okay. Not only that, but because if you knew the sort of immunobiology and the virology of SARS-CoV-2 as a plus-sense RNA single-stranded virus, it mutates. Its rates of mutation are among the highest of all the classification of different viruses. So we knew this thing was not just going to be eradicated, right? I mean, it wasn't realistic. And now even Dr. Fauci himself was saying this right before Christmas. Okay. Number 10, promoting healthy living causes vaccine hesitancy, dude. Stop talking about exercise. Okay, false. This is false. How can this ever be considered realistic? We know healthy living, if you are under the belief that we're going to vaccinate our way out of this problem, you should have been the biggest proponent of healthy living because guess what? The data is quite clear. Healthier people who exercise, people who have low body fat, they produce a much superior antibody response after an immunization. And they don't have the same degree of antibody waning in the post-immunization window. So it's very interesting. The people who are very pro-vaccine are not pro-health. Like it's like this weird false dichotomy when they should be very pro-health, but it usually isn't the case. And I think that's really bizarre. Now, you might think, oh, that's a conspiracy theory. Everyone's response to the immunizations is the same. No, it's not. We've shared data from Italy. We looked at the smoking status, high blood pressure, waist circumference. These are all factors that are inversely associated with antibody responses after the immunization. We recently reviewed a study that looked at individuals who have rheumatic autoimmune disease. Those individuals in general tend to have a suboptimal immunization response to a vaccine. It turns out that when the data was stratified for people who exercise regularly compared to those who don't, the exercise group had a statistically significant increase in post-vaccine antibody levels. So the public health experts should have been promoting exercise concurrently. That would not have been fueling the so-called vaccine hesitancy movement whatsoever. Okay, here's one of my favorites. Dude, natural immunity is not durable, man. You're promoting misinformation. Okay, give me a break. All right, we're 2 years into the pandemic. And we have highly vaccinated cities that are setting records for their case levels. Okay. So why would we assume now, I have to be careful with how I word this because of this platform, but why would we assume that natural immunity, because it's more robust, you're making immunologic memory to the non-structured proteins, ORF1 through ORF14. You haven't heard about those, but these are features of the virus that your immune system creates memory against. The nucleic capsid, which is another immunologic antigen part of SARS-CoV-2 that your immune system remembers, and the spike protein. So you have this array. It's called redundancy. You have this redundant array for many viral antigens that you're not getting, with all due respect, from the current available vaccinations. So why would we think that, well, if we just give the immune system this one target, the spike protein, that it's going to sort of be way better than this diverse array of all these different immunologic antigens? To me, it never made sense. Either way, right, if you get the whole virus, right, via infection, or a piece of the virus, i.e. the spike protein, it's your own immune system that needs to mount the protective response. Like in both situations, you're not getting a surrogate immune system in the shot. You're getting a piece, an antigen, what's called something that your immune system will recognize, remember, and create memories against in both scenarios. So in both scenarios, I know this might piss some people off, you have to rely upon your natural immune system to create the response. So why would we have doubted that in scenario A, i.e. natural infection, but assume that it was more robust in scenario B, i.e. immunization? It didn't make sense. And I think what we're starting to see now is the rates of reinfection in people who were previously infected are quite low. All right, so let's talk about number 12. This one is quite interesting. Talking about people who have died or gotten sick from COVID, or people who happen to get sick for other reasons and test positive for COVID. Now, again, us conspiracy theorists said, well, look, why are people in the hospital in the first place? Is it because they have uncontrolled diabetes and they also happen to test positive for COVID? Or are they really sick from COVID-19? We were considered the anti-science, grandma killers, and all this sort of stuff. Well, it turns out that Dr. Fauci himself and even the New York healthcare system is going to start bifurcating cases based upon this. Are people in the hospital with COVID, right? Because they broke their ankle, they had blunt force trauma to the head, and they happen to test positive, or are they in here for COVID? Now, again, what's considered a conspiracy theory. If you said this, you weren't taking the pandemic seriously. That was sort of what the people said. And now it turns out, well, they were wrong. Now the experts are starting to say this. And a lot of the children, even during the Delta outbreak over the summer, happened to be in the hospital for respiratory syncytial virus, RSV. And some of them happened to also test positive for COVID, but it was really the RSV as to the reason why they were hospitalized. That's not a conspiracy. You can look at the data, go into PubMed, type in RSV 2021 COVID-19 and see the data yourself. Okay, my friends. So that was considered a conspiracy theory. Now all the experts are talking about it. Okay, number 13, closing those fitness centers and gyms. That is going to flatten the curve because all these people are just dying, dropping dead in the gym. False. That was the... Maybe I'm putting this in there because it's a little personal to me. I love exercise. Going to the gym was a place of social connection for a lot of people that have sedentary jobs or work at computer screens, and removing people from their ability, restricting their ability on a governmental level. I think the government should have never gotten involved in what people are doing with regards to exercise. The government went as far in California and other places to close the parks. In the UK, they restricted how many miles you could be away from your house. In Australia, they limited you to how much time you could have indoors if you're vaccinated versus not. If you're fully vaccinated, you get 1 hour of outdoor activity. There was insane amount of silly things. But closing the gyms was, I think, one of the dumbest ideas ever, especially because we now know how protective fitness is with regards to supporting the immune system and, as we've talked about before, making vaccines more efficacious. Okay, so we shouldn't have ever closed the gyms. Okay, number 14, closing schools is a good idea. I was vehemently against that, as were other people, because we know. So what happens to these kids? Not every child, unfortunately, has a great home. People get sexually abused, physically abused, mentally, verbally abused. I've had siblings that beat the crap out of me when I was a kid, and schools was my only escape. So when I heard that schools were closing, I just had this flashback of dude, oh my gosh, if I was back in elementary school or middle school knowing that, I would have been terrified due to the situation that I was in earlier in my life. And I know there's probably tens of millions of kids who are in that situation where they have an abusive either parent figure or sibling And that would have just been just so terrifying. Like for me, I probably would have ran away or done something worse, right? And so I really, again, maybe this is personal, but a lot of people didn't think of this. You know, they drive Teslas, they have a nice house, they work for Amazon or Microsoft, they make, $200K a year on a computer. They don't think about these things because their worldview is completely different. And so we've sort of not considered the little person, that small business owner, the kid that doesn't have the fancy home and the Tesla and all of this, right? We haven't considered that throughout this whole pandemic, and I think it's time we do that going forward. Okay, number 15, lockdowns were necessary, and we may need more lockdowns in the future. Okay, completely dumb idea. You know why? Because this virus was totally transmitting long before. Okay, now I can see what Australia tried to do and New Zealand tried to do. They tried to completely prevent the virus from coming in, and to no avail, right? It didn't work. If you look at some of the Red Cross blood sample seropositivity rates, the virus was transmitting in Santa Clara County. Stanford University, Jay Bhattacharya and some others had actually looked at this in March of 2020. It was transmitting in late fall of 2019. And people have talked about this. Once there's community spread, lockdowns are not going to do anything, right? Because it's already in the community. It's going to spread around regardless. Not only that, to assume that society is just going to continue to function and not consider the unintended harms of all the people who are out of work, jobless, now sort of managing their stress with drugs and alcohol, fentanyl. Fentanyl killed more people under the age of 30 than the virus did. So again, dumb idea, but these are still being talked about. In fact, to the best of my knowledge, in the province of Canada, Ontario, they're reconsidering, or it's a modified lockdown. And so even though we have all this data, policymakers are seemingly blind to it, or oblivious to it, or the government's just incompetent or unorganized. I'm not sure. I don't know the intent, but we know that. Now, number 16, voter ID is racist, but a vaccine passport is somehow equitable. I mean, this one to me never made a lot of sense. And so over the summer, we heard all about, and I'm referring to, the summer of 2020, all about how voter ID is just, it's so problematic. I mean, it's so terrible. And again, maybe this one hits close to home because my wife is a Canadian citizen and she can't vote. But she could have probably voted in King County and just said, I don't have my ID, and no one would have cared. But yet now we can't even go out to dinner because we're unvaccinated, right? So the politicians have created, again, sort of these selective policies that apply in one context but don't apply in another. How is that equitable? You have people who have medical reasons. For example, I have a neighbor who has Guillain-Barré's, and so he's not getting vaccinated for obvious reasons. And so he's unable to go out to dinner, right? We're like, well, if all the other people are vaccinated around him, why is he a risk factor? And so he can't go there. So those are the top conspiracy theories that I was able to come up with that turned out to be true. What do you think? I want to know what your favorite of this, or if there's one that I possibly missed. I'm sure there's something that I missed and we missed here. So friends, the point here, I'm not trying to belittle anyone. I'm not trying to pick on people. It's just to get us to think a little bit better, to think about the unintended or the indirect effects of our actions, right? Especially when it comes from a policy and it's impacting a lot of people. And that's what public health is designed to do. Public health is designed to maximize the quality adjusted life years of the population, not a small subset of the population. And so, the quality adjusted life years, we took a massive withdrawal from the children's bank accounts, from the people under the age of 45. We took a massive withdrawal from their quality adjusted life years. And the net benefit of the quality adjusted life years for the elderly was marginal at best. Okay. In fact, I would argue that all of the isolation that the people over the age of 65 underwent, forced isolation, probably hit the accelerator or the gas pedal on dementia, diabetes, all of the diseases that are sort of a consequence of social isolation, which has health benefits. So I make this video not to be a jerk, to encourage you and the people around you to think better, to start to think about, maybe those handkerchiefs were not a good idea. Anyway, friends, thanks as always for tuning in. If you're enjoying this content, please hit that like button, leave me a comment below, and hopefully enjoy these resources, and we'll catch you in a future video down the road. Bye now.